Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Boom! Cracked ribs. We're going to talk about the best treatment for success. And yeah, I know people were looking at Brad here and they're thinking that he was trying to slim up a little bit, wearing a girdle, but that's not what he has in mind here.
Right, exactly. Although I did think about that last week. Anyways, cracked ribs. We have not done a video on this yet, Bob. And it's time that we do it because there's some information that is a little misleading and things have changed in the last few years.
Also, you just had a friend that cracked his ribs, so we're trying to put together a video for him.
Exactly. He fell off of a ladder, as a matter of fact. He's, I don't know, early 60s, good, healthy early 60s, but you just don't bounce back like you used to,
Right.
even if you're a healthy 60. Sorry,
Well, I
Vince.
think you first started off by saying cracked ribs.
Well,
Like
that's
Bugs Bunny.
We got to get that speech therapist going.
By the way, we got a couple new subscribers,
Yeah.
Brad. If you want to go ahead and take a second to subscribe to us, we have a subscription button on the other side of
There
Brad
you
or
go.
down here. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
Excellent, Bob.
All right, Brad, what are we going to first talk
Well,
about?
cracked ribs. Let's look at Leopold. Whatever. Napoleon, sorry. But we're looking at the ribs, and you can see on here the ribs. If you look at the color of the ribs here, is that coming in, Lonnie? They're clear, and then they look like bone here, and that's because between the sternum and the ribs, there's a cartilage area right in here.
Yeah, this isn't really bone. This
Right.
is a really tough fibrous
Right,
material.
and that's there because when you breathe, your ribs have to expand and contract or get smaller as you breathe in and out. And
Don't they kind of come up like this, Brad? A
sure,
little bit, yeah.
yep. And that's the thing with ribs. There's not only ribs to be cracked or this cartilage that could be ripped or tore, but there's muscles
Yeah,
in
the
between.
intercostal muscles.
And it's quite a network.
Yeah.
There's muscles going different directions, and they're in there so that when you exhale, they all contract and they push that rib cage together so you can talk, breathe, laugh, etc. All the things that
Very complex movement, isn't it?
exactly.
So-
And to understand that makes it so clear why when you crack those ribs, you want to avoid laughing.
Sure.
You know, that
So you
kind of
shouldn't
thing.
watch us.
Right. So anyways, that's the function of the ribs. Plus they protect your heart and your
Organs,
lungs.
yeah.
Yep, exactly.
He's got a little rib problem right there.
Oh
right?
yeah. Well, we'll take care of that
We'll
later.
take care of that, Napoleon. So this device, is this good or bad, Brad? Or
Right.
am I thinking too early?
And this is what I referred to before is years ago it was wrap the ribs, compress them, protect them with some ACE bandage or you know, some Comprolon. And now they're finding out that this is what you do not want to do.
So this is a no-no.
Right. So let's take this off right now. There we go.
You're
Get it
just trying
away.
to get your attention, but we found that in our old supply book.
Right,
shelf.
exactly.
So-
That's very good for other things, but not for cracked ribs. And now the next big question, Bob. Do you need to see the doctor? Because as people say, well, they don't do anything with them anyways. You just
Right.
go home and...
There's no repair done.
Exactly.
Let them heal.
But there's one exception, Bob, and that's if you have a crack where the bone of the rib actually punctures the lining between the lung and the rib. Yep.
Right.
And with that,
Goes right into the lung.
Right, you can get a collapsed lung. And it could be a minor one where it takes a while for that fluid to get into the lung and cause that problem. That's called a pneumothorax.
Right.
But that
Nothing
can
to
be,
mess with. That can kill you.
right, that can be serious. So because of that, it's probably a good thing to go to the doctor, make sure that's
I think
clear.
you have to go to the doctor.
Yeah.
I mean, you just have to.
Okay.
No way around that.
Other things that you're going to find when you crack your ribs outside of the pain with coughing, laughing, deep breaths is you may find yourself short of breath for obvious reasons and dizzy. And the reason for that is you cannot breathe deep, so you may get less oxygen to the brain and cause some dizziness.
And you may throw your breathing off too.
Right,
I mean, you may do
yep.
more shallow breathing,
Yep.
and that can just throw you off.
And the anxiety of it, you may
Right.
get some anxiety involved. You know, it's not when you cannot breathe,
Yeah,
your body
it's a
reacts
panicky
different.
situation.
Exactly. And then general fatigue because you're not able to breathe when you're working harder because of the pain that the ribs kind of.
Pain is fatiguing too.
Exactly. So it all works together.
So treatment, Brad.
Yeah. After you see the doctor, make sure you don't have a pneumothorax. They're going to say put a cold pack on it, not heat. Heat might feel good, but it's going to draw fluid to the area and actually make things worse. So get a cold pack on it. You can do that for 15 to 20 minutes. get a comfortable position. And this is something else I wasn't aware of. I did some research recently, is you can lay on the side as long as it's not too painful. In your bed, you're going to lay on that side. And the reason for that is it reduces your chance for pneumonia or getting fluid into the lungs. And I'm quite certain that's because of the gravity flow of the fluid.
Sure, makes sense. So that's interesting. Well, can you lay on your back too?
Yeah, you can lay on your back. What's comfortable. Right?
Sure.
But you shouldn't lay on the opposite side. Right.
Okay.
Okay.
NSAIDs.
NSAIDs,
right?
ibuprofen across the counters. You know, if you go to the doctor, they may give you something a little more stronger or for the pain.
But yeah, generally ibuprofen will do it alone. And remember, you always need to eat something when you take ibuprofen.
Right.
Eat a piece of toast or something like that.
Milk is a good thing. With the meal is even better. The next thing, and this is something I think a lot of people are not going to be aware of, is you actually want to start breathing some deeper breaths as you're improving, not the first couple of days, but within the first week, as the ribs start to heal, you want to start breathing and expand those ribs into a little bit of pain, not that sharp pain, but a little bit, because what's going to happen, if this is where that injury is, there's going to be scar tissue forming all over to heal those ribs and those muscles. And when that scar tissue forms, it's going to tighten things up. And if you didn't breathe at all, if you did shallow breathing for the 6 weeks of healing, you're going to find a tight spot here. It's going to be painful when you move, and you're not going to be able to breathe deep again. It's going to affect how you function.
He's talking about those little muscles in between the ribs.
Right.
Those are the ones that are going to scar up.
Right.
And, the scar tissue. And a lot of times what could happen too later on, it could re-break open the scar tissue, and you could have more pain again then.
Right,
So,
exactly.
You need to have it heal strong, as we always say, so that in a lengthened position.
Right. So work that breathing as it's healing.
Breathing.
And they typically say 6 weeks and you're going to be healed up, with the exception if you did tear some of those intercostal muscles away from the ribs. That can take even longer. That can take a few more weeks longer, and that's where we're going to show you some exercises in a little bit that are going to help you with the healing of that, so the scar tissue doesn't bind things up and you get back to a normal breathing.
Get everything in good range of motion, and you don't find yourself in a tightened position afterwards. So.
Exactly.
So where are we at, Brad? What are we going to start with the exercises?
Sure.
Okay.
Now, we need a chair. Bob, we're without a chair.
Well, why don't you show on here first, Brad, the rotations.
Exactly.
And then I'll grab a chair.
Yep. You need a chair with the back on it. That's, for some reason, we didn't have one here, but rotation. When you rotate the trunk, the thoracic vertebra, which connects to the ribs, are doing a lot of movement with rotation. So when you're driving, you got to look behind you, or in a tractor, look behind you, because Vince, who broke his ribs, he'll be out in his tractor soon. There's a lot of movement going on in those ribs, which is going to hurt when those are healed. And if you want to get that to stretch, okay, the proper way to do this, or the best way, is to sit down so that locks your pelvis in. You're going to find a cane or pipe. This is a piece of PVC pipe, nice and light and plastic. Put that over your shoulders like this with your hands here. That locks the shoulders in. Your pelvis is locked in. And now when you rotate like this forces all the rotation to come from, well, not all of it, but a good part of it from your thoracic spine. Okay.
And what's nice about this, Brad, is that it does, force it to occur in the thoracic area.
Right. If you stand.
Yeah. Now see, he's getting it from the
pelvis,
legs,
right?
Pelvis,
so we want to do it properly and get the most bang for your buck.
And if it hurts in one direction, work the other direction.
Exactly. If it hurts a lot that way and not so much this way, go to the right.
Work to the right, and
bump
eventually
this
the
way
left
a little bit.
Yeah, eventually the left should come.
Yep. And you're going to do these about 10 to 20 repetitions 3 times a day, depending on how it feels. Go ahead, Bob. Show them the next one in the chair.
Yeah, what's nice about this is if you actually, can you give me a ball too, Brad?
Oh, sure, Bob. Oh, I don't know if I want to give you the Packer ball, but here you go. That's
always nice about this.
That's success, Bob. So Packers are success.
So what we're doing is, if you have a chair that hits you about right, usually a little bit below the shoulder blades, what's nice about this is you can just go ahead and bend over it and gently stretch. Again, we're expanding everything.
Right.
We're getting the rib cage opened up here. You can put your hands behind the head and go like this. That actually works better sometimes.
An office chair that doesn't go very high, that's padded, can be comfortable for this.
Let's say you have a really high chair that doesn't, goes up really high. Take a ball like this. I really love the Packers.
Yeah, Bob.
And you put it in there.
You got to get over that.
It's a double bonus here. I get to squish them. And you can lean back over the ball. This works really nice.
It does.
And you can move it in different spots then,
You're
Brad.
not going to use a basketball or a soccer ball. It has to be a ball that
Yeah,
squishes.
one of those squishy balls.
Yep, exactly.
So works out really well. You can do this in a standing position too, Brad. You want to show
Sure. Yep. So a standing, we're just going to go back like this. And this one, it would be nice, you know, to put a belt possibly.
Sure.
Where's our belt, Bob?
We're not really prepared here today, are we, Brad?
Well, I didn't think we were going to get this far, but you take a belt, and this is, you could use a TheraBand like this, or belt right across here, and you stretch backwards and you pull. And this is, this next one, after you get done doing this.
That belt actually would really work out well.
Yep, it would. Is the apple picking stretch.
What
you
is
can
that,
do it
Brad?
seated or standing. You just pretend there's an apple up there, and you reach up high, and
sure.
it stretches those ribs so you get that range of motion. So you get, and typically going forward comes on its own because we've been so much forward so often during our life. Oh, yeah, thank you, Bob.
I imagine too, Brad, you might even do this, like grab down here
Sure.
and come back up here
Yep.
for like P and F, where you kind of, you know, get the different motions of
Sure,
the rib.
you bet.
So, well, that should give you a good start,
Right,
right?
and this is, again, very close to the subject that we're really going, we're going to get our PhD, I'm thinking, on. We're going to be able to fix anything except for that.
Broken heart.
Yeah, but we're working on it. As a matter of
PhD.
fact, I got someone lined up for another video on this coming up.
Wonderful.
So, all right.
PhD, by the way, is piled high and deep. You know that, right?
Yeah, I learned that in college.
All right. Thanks
Thanks.
for watching.